Positive Behaviour Support is PBS. It's an evidence-based approach to challenging behaviour. What we do is we look at behaviours and we look at what the functioning equivalent behaviour is for that behaviour. When somebody engages in challenging behaviour, there's a reason behind that. And as behaviour practitioners, we want to look at what is the more functional way of them being able to gain what they're trying to achieve. So a behaviour support plan is a document that a behaviour support practitioner will write for the client that will include everything that somebody needs to know when working with a client. In a behaviour support plan, we look at every single environment that a client will be in. So for instance, if we look at a child who goes to school, we will do an in-depth look at what behaviours that the child is engaging in school, so that we will have information on all different settings. In a behaviour support plan, we look at behaviours. We identify what the behaviours that are challenging. So we will list them so everyone will be able to easily identify what those behaviours are. Then we look at what we call proactive strategies. So these are functional strategies we can do to teach the client for them to be able to functionally gain what they achieve without engaging in challenging behaviour. We also look at non-aversive reactive strategies. The non-aversive reactive strategies are a method of everyone being able to respond to a challenging behaviour. We all know that when you respond all together in the same way, that there's less likelihood that that challenging behaviour may occur. Consistency is key, especially when dealing with challenging behaviour. We also include a functional assessment within a behaviour support plan as well. So the functional assessment is when we do a really deep dive into the client's background, their information and their environment. Within their environment, we look at what are they trying to achieve and trying to figure out what the function of the behaviour is. So what are they trying to achieve by engaging in this behaviour, and why does it continue to happen? Then we look at, okay, this is happening right now. How do we change everyone in their environment's way of responding to this behaviour, and how can we teach them to actually gain this a lot more functionally? This is done in a step-by-step process, and along with the behaviour support plan, you get a number of hours of training as well, where we train everyone in the environment to be able to respond appropriately to these challenging behaviours, and also to be able to implement the proactive strategies, which are the most important things. These are the key for changing behaviour. It's the teaching skills. We do a really deep dive into the functional assessment side of things. So we interview a lot of different people, anyone involved in our clients' lives, school, sisters, brothers, aunties, anyone that has anything to do with the behaviour that's happening. That's the really important thing. Because when we do this deep dive, we actually figure out that a lot of people respond to behaviour very, very differently. And this is where the behaviour can be maintained. So this is where we want to make the change. So a positive behaviour support plan can be used for anyone that has behaviour difficulties. That includes anyone that has intellectual, learning, social and developmental difficulties in their everyday lives. We do it as a person-centred approach to individual needs, and a lot of it can be based on social situations as well. So it's very individualised. It's not just for, a certain disability. So behaviour support plans are really, really important for individuals, because when somebody who has, for instance, a diagnosis, they may see a lot of different stakeholders throughout their lives. They have different therapies coming up. As a behaviour support plan is something that's used straight across all environments, then people are able to read this document and be able to have ideas about their clients that they may not necessarily know. They will know how to deal with challenging behaviour in every different setting, because we do this deep dive into what happens at therapy, what happens in school, what's happening in the home. So we bring all of this information together as a whole, and everyone can use one. All stakeholders can use this document it's as a number one go-to to be able to read about all of the challenging behaviours our clients exhibit and what are the best ways to counteract that to react to these behaviours and what are the best possible ways to go forward as well. Along with a behaviour support plan, as I mentioned, you get a lot of training as well in how to implement these things. And a big part of it is training within stakeholder groups. So when a behaviour support plan is implemented, training will be involved with anyone involved in that client's life. Quite recently, PBS, especially within the NDIS sector, is becoming a bit more prominent because people are realising that you can actually get this service within your NDIS package, which is amazing. We are funded under the Approved Relationships. Quite recently, as a clinician, I'm out there and I'm talking to fellow clinicians, especially within the health hub, saying, did you know this service is available? And we are gaining a lot more referrals. Within the community, I'm always seeing people that would highly benefit from a PBSP. Behaviour support plans are life-changing, and that's why I'm in this field myself. I see that the amazing work that they do in that just a behaviour support plan can do for an individual's life. It's a person-focused, and it's also evidence-based as well, which is really, really important. This works, it works for people, and it is life-changing. It's person-centered, and at the forefront of it, it is, what are the main things that this person needs to be able to live the most fulfilling life. And that's why PBS is extremely important and should be sought out. If there is challenging behaviours, we can change this, we can help. So within the Health Hub, we have an amazing behaviour support team here at the moment. What we offer is some really, really good facilities, along with the flexibility to be able to go out into environments as well. And we work with individual families to figure out, what's best and how do we get this information to make the best possible outcome for that client at this time. Our behaviour support practitioners are really, really flexible with making those appointments with everyone involved. So the Health Hub have a range of multidisciplinary clinicians here within our company, and PBS is fitting in really, really well with everyone else here. We provide a very unique service, and we work in conjunction with a lot of our other clinicians, OTs, speech pathologists, and also our psychologists, where they can see referrals and the absolute amazing work that we do within the PBS team as well here. We do a lot of internal referrals, and they identify that PBS is amazing and we could help a lot of our clients as well. So working within that multidisciplinary model has been amazing, where we're all working in conjunction with each other. Also, the Health Hub provides an amazing different individual clinicians. We all have a very different backgrounds and a very different path to the PBSP theme, which is amazing because we all bring some amazing different ideas, different ways of developing strategies, and we also have some really good supervision sessions as well, where we are able to talk through different topics, discussions, and everyone has really good backgrounds. Me personally, I come from an ABA background, which is applied behavioural analysis. I've been working in this field for about 10 years, predominantly with under 18s with autism. We also have people that have come from predominantly adults, individuals who need some social skills. We also have developmental educators. We have psychologists. So we have a number of different people working in the PBS team at the moment, which is amazing. It makes life really interesting, and there's always someone to talk through cases with to get the best possible outcome.